everybody. Sorry about the little bit of delay, but thank you for joining us. We're glad that you're here for our media briefing that we do every Thursday afternoon, a question and answer time, but also a time to give you some updates on what's happening in Eau Claire County related to COVID-19. Today is Thursday, March 11th, and again, thanks for joining us. And I'm sorry, it's not March 11th, it's March 18th. There you go. It's an update of me glancing down. So it's March 18th. Thank you for joining us. This is our question and answer time with media, as well as a time to update related to COVID-19 in the Chippewa Valley. This year has been a challenging one. This week, a year ago, a lot was changing, and you've been joining us since that time. Again, we appreciate it. You may remember that a year ago, we were having increasing COVID-19 cases across the U.S., across Wisconsin. It led to some limits in gatherings and in school attendance and other activities that made a big difference in our community. March 17th, yesterday, was when many things closed down. March 19th, tomorrow, marks a year since our first COVID-19 case in Eau Claire County, as well as in a number of surrounding counties, Dunn and Chippewa County as well. At that point in time, our cases were related to travel. Much has changed now. Our cases have flattened in recent weeks, but they really are primarily related to spread within our community. And as you all know, we've had many, many cases since that first case on March 19th, a year ago. We also want to recognize that it's been a year of loss. Most importantly, for those family members and neighbors and colleagues that have lost a loved one, it's a year of loss connected to that. People that have died related to COVID-19 are significant, and we do need to pay attention to that. Our hearts and thoughts go out to people that are mourning those losses because of COVID-19 this year. I think the reality of that is hard to get our heads around. We've not had death related to a communicable disease like this in a very, very, very long time. It's been hard for everyone and harder for some, the course of COVID-19 in our state and in our nation. We do want you to know that for anyone that is struggling, there are resources available, a reminder of the Resilient Wisconsin website, and a reminder to call 211 if you need someone that can refer you to resources, assistance with food or rent or those things that have gotten more difficult with COVID-19, or if you'd like to get connected to someone that can support your mental health as well as your physical health. We need to learn and lean on each other from time to time. Some of us need more reminders about that, to accept help when it's offered, but there is help available. We also can be a resource to one another. It's okay to ask for help, and it's definitely okay to give help to each other. And we need to do that during these times, especially when it's been difficult. Today, after we walk through our data, we are also joined by Prevea President and CEO, Dr. Ashok Rai. He's here to help share with you, like we've been doing with other people in our healthcare community during these media events. We've provided opportunities to have other people talk to you a little bit about where we're going with things like vaccination in our community. So he will be sharing a bit about that in a minute. I'll share first, though, some local data, like we usually do at the top, and some of our state data, and then we will walk into that. So we now have 11,136 Eau Claire County residents that have tested positive for COVID-19, an increase of 46 individuals in the last week. We're averaging about 7 cases a day. And again, our goal is to be at least below that 10 case a day average, which keeps us in a manageable place for COVID-19 response, our public health response, as well as our healthcare response. So we're doing much better. We still have a long way to go, and we are watching carefully what happens with the variant strain of COVID-19 and carefully what happens as people may start gathering more in the weeks and months ahead. We are actively working with 74 Eau Claire County residents that are currently isolated or quarantined related to COVID-19. And it's the 74 that are cases, so they are isolated, and then all of their close contacts as well are being actively worked with right now. We've had 367 Eau Claire County residents that have been hospitalized since the start of the pandemic, and 106 individuals that have died related to COVID-19, an increase of one person since last week when we last spoke. The state data that we talked about last week, the cleaning of that data, which happens regularly at a state and local level, but is happening in a more concentrated way these last couple of weeks, is continuing. We are seeing case numbers fluctuate a little bit with that, where probable cases are becoming cases, which count on our disease count, and vice versa, where cases that were named cases are now, because they are antigen positive cases, being moved to the probable category. We'll continue to see that movement a little bit over time. And again, where I said we had 46 cases, actual new cases this week, on the website, you'll see it says 52 cases. Those are some old cases that were previously identified as probable cases and were actually PCR cases that were moved to being cases, but they are older cases, not ones that happened in the last 7 days. We'll keep sharing with you as that cleanup happens. We know you want the information that you are getting to be very clear, and that's part of the communication we're trying to do. Other Eau Claire data that we typically share, again, about 13% of the cases that we have are related to UW Eau Claire. UW Eau Claire continues to be doing antigen testing of off-campus students, on-campus students, and faculty in a fairly regular way. And that continued partnership is critically important. We have 18 public health investigations happening, and that's been going down, which is again good. About 60% of those investigations are in sites like education and workplace. Our state rating for COVID-19 remains at high. That is the same rating we've had for the last number of weeks. And again, we are watching that carefully. We are hoping to slowly bring that down, and that trajectory is flat, and that is good news. We are hoping that that continues. Our positivity rate is at 3%, and again, slightly down from last week. Positivity rates across the state continue to be lower, and that is part of the positive news that we have across Wisconsin. Our testing continues to trend downward, though. So again, a reminder to people in our community that testing is an important part of our strategy to move forward with COVID-19. If you've been in close contact with people that are COVID positive, get tested. If you are having any symptoms, get tested. And if you are engaging in behavior that does put you in closer contact with individuals that you don't know their COVID-19 status, please get tested. It really helps us as we step forward to know who is potentially positive in our community and slow the spread from that circle. Other data metrics that we do report weekly as part of our look at what's happening in Eau Claire County, our regional hospital bed space has been good. At the inpatient level is at that green indicator. Our ICU bed space is at yellow, but there's no indication that that is related to COVID-19. Community spread is at 44%, and it's an increase from previous weeks. So again, that indicator is about where people have gotten COVID-19 from, our positive cases, and 44% of them don't know. It wasn't because they were in close contact with a family member, for example, that is COVID positive. So a couple of state measures. The state number of positive cases is now at 571,220. Their active case level for the state is at almost 64,000 cases, and there are now 6,556 individuals that have died related to COVID-19, an increase of 32 Wisconsin residents that have died. So we, again, are not in a place where the COVID disease cases has no impact. We have still people that are being hospitalized. We still have deaths related to COVID-19. So critically important we stay the course with the mitigation strategies, critically important that we continue to pay attention to what's happening in our community, and also important to celebrate how far we've come from a short couple of months ago. Vaccination continues to be an important piece of how we are going to move forward. Our department and people across this community are doing amazing things to make sure vaccination happens in Eau Claire County. If you've been following the data for vaccination, you'll see how well as a community we are doing in getting vaccines in arms. We are fortunate to have an amazingly strong group of approved vaccinators in Eau Claire County, and they're doing just work that is tremendously valuable for getting us to the next step. The limiting factor continues to be vaccine, and we're starting to see some improvement in that. Nationally, more vaccine is getting out. Wisconsin is getting slightly increased vaccine levels, and we are all, as vaccinators, hoping that that continues to improve. We're also, as vaccinators across Eau Claire County, really aware that some people struggle with getting vaccine. And we are paying attention to that. The vaccinators across the county are working together on barriers. And I'll talk a little bit more about that, but barriers such as language barriers, technology barriers, barriers related to traveling distance and having an available way to get somewhere, as well as hesitancy issues with getting vaccine are all topics that we are all working on in the Chippewa Valley together. Do go to our website to get more information about some of this work and about all the amazing vaccinators in Eau Claire County. Again, that reminder that we have a one-stop shop on our Eau Claire County COVID-19 eauclaire.org webpage. And to share a bit about one of the partners that's working in the Chippewa Valley, Prevea, Dr. Rai is going to talk a little bit more about vaccine, and we're really happy that you're joining us today. So I will turn it over to you.
Thank you, Lisa. Thank you for having me. And hopefully my audio is okay there. We're at a really good inflection point in the state of Wisconsin when it comes to vaccines. And, all numbers aside, this is the time to somewhat have even more hope than we had when we first got the vaccines announced to us. The reason? Well, we've already injected this piece of hope that we give everybody many times in Eau Claire County. If you think about the people that we've lost across the country and within the state of Wisconsin, within the county, 65 and older was a population that was one of our highest concerns and our greatest priority. And now to almost eclipse 3/4 of our population that are 65 and older in the county to be vaccinated, I think we're just under 75% this afternoon. And knowing probably by now we'll cross that with shots going in arms is a great point to now say, who's next and who can we protect more? And if you look at outside of the 65 and older, it was those that were under that age, but had an underlying health condition that was one of our largest concerns going into this on protection. And the governor has announced a pivot, as we say at Prevea, and even moved up the date where we could provide hope to that group of patients. And that starts on March 22nd, all across the state of Wisconsin. And all the vaccinators in Eau Claire County, from healthcare providers to the counties themselves, who've gotten great news today on the expansion of vaccine accessibility within the county, will be able to start vaccinating people next week that have those underlying conditions. I think one of the things I like to point out is that if you do have one of those underlying conditions, and you can find that from our website, the county website, or the state website, if you have those, is to encourage you to become vaccinated. You are the people that we care about the most when it comes to contracting COVID-19, because your illness could be more severe than, say, somebody who doesn't. The other thing I would encourage people to understand is that we need patience. As was just said, vaccine supply probably isn't exactly where we need it to be today, but it's getting there. And this is a very large group of people that we're going to try to vaccinate over this time period. So be patient. Make sure you're looking at all your resources and all the places you can go for a vaccine and wherever it's comfortable to make sure that you get vaccinated. Also, part of that great inflection point is the state of Wisconsin now has access to 3 great vaccines, as does the whole country. 3 vaccines that work exactly how we need them to. They prevent death, they prevent serious hospitalization. And everybody asks me, which is the best vaccine to get? The one you can get, because all 3 work great. And what happens after you're vaccinated? I think that's something that we haven't talked about a whole lot because the information and the guidance is just coming out right now. But once you've received a vaccine, one of the most important things that you can do is gather with other people that are vaccinated. But we need to understand the definition of being fully vaccinated. So if it's a two-shot regimen like Pfizer and Moderna, it's getting both shots and waiting 2 weeks after that second shot. If you're getting the one shot through J&J, it's 2 weeks after that shot. But once that's done in small groups of fully vaccinated people, you can take that mask off. Or if you want to visit a single household with low risk individuals, and by low risk, we're talking about visiting children or people who are otherwise healthy and you're vaccinated and you're protected, you may visit them. This is a great scenario for grandma and grandpa finally getting to see their grandchildren. But let's just remember that the people you're visiting have to be low risk as well. Otherwise, let's wait for them to get vaccinated, and they can if they have risk factors starting next week if they're over the age of 16. All great things going on in the county, all great things going on in the state and the nation, but it's not the finish line yet. And I think I need to end with reminding everybody until we're all vaccinated, we need to keep wearing our masks, remembering our physical distancing and our washing our hands, not gathering in large groups unless people are vaccinated, and still making those small groups. Let's keep each other safe, prevent this virus from spreading any further, causing any more damage, while we as vaccinators, as healthcare providers, partner with your local public health department to get everybody vaccinated. Thank you.
Thank you very much, and thanks for all the work that Prevea and all of our other partners are doing. It's a heavy lift to think about vaccinating this size of our population. We've never had to do something like this, and to have the partnership that we have is really, it provides a lot of hope across our community. So thank you, and thanks for sharing that word. I think hope is really powerful for all of us right now. And I would name that we are close. Doing those basic things like wearing a mask when you're out in public spaces and in gatherings to keep your gatherings small is still important. We want this to move forward as quickly as we possibly can. So a couple of additional announcements, and then we'll move to some of the questions we got in advance, and then I think both of us will be available to answer questions at the end if we have some time. First of all, the governor today did announce, and likely many people saw, that there will be another mass vaccination location in Eau Claire County starting April 8th. That mass vaccination location is a partnership between FEMA, the Federal Emergency Management Association, as well as UW Eau Claire, the State Health Department, and Eau Claire City County Health Department. The state has been working with FEMA for the last number of weeks to find locations across Wisconsin that would host a FEMA site. So earlier this week, or maybe the end of last week, Milwaukee was named as a FEMA location. There are other state-managed AMI or state-managed mass vaccination sites happening in various parts across the state. And this will be an additional mass vaccination location that the state has positioned, and we are working with FEMA and the state to make happen. I want to name that we have amazing mass vaccinators already in Eau Claire, so this is not any reflection on the hard work and the available capacity that we already have in Eau Claire. This is an additional regional site. The site will be available for individuals across the Chippewa Valley and much wider than that to come to a location that is a very large throughput location that can get vaccination done quickly once we have that vaccine supply available. We're excited to partner with UW Eau Claire and have Health Department and UW Eau Claire walking together with the federal government and the state government on this. We are expecting this to start April 8th at Zorn Arena. We are still waiting to hear about the vaccine supply that will be available, and it likely will ratchet up over time. We won't have what is predicted to be about 1,000 doses a day available until probably for several weeks, if not months, as more vaccine becomes available in Wisconsin. But again, we want vaccination to be easy for everybody in the Eau Claire area and in the region. And this is an additional asset that will becoming, and we are looking forward to working with the team of partners on this. A reminder to everybody right now, as Dr. Rai indicated, we have many more people eligible to be vaccinated starting Monday. The estimate is about 70% of our population meets criteria within that newly eligible group. Please look online. The newly eligible groups are listed on both the state website as well as information available on our website to link to that. And go to our website to find out how you can easily find an appointment to get vaccinated when vaccine is available. Again, a reminder that we all, as vaccinators, have capacity, but right now are not getting enough vaccine to get shots in arms of everybody that will be newly vaccinated on Monday. We wish we did get that amount of vaccine, but we know we will have minimal doses available for the next several weeks compared to that full population. But we want people to know they're eligible. We want you to have those resources. So again, educators, those over the age of 65, people working in the court system, all of those people that are currently eligible, please still move forward and get a vaccine. We really see it as a way, if we all move forward to do that, as a way to take the next step. So currently eligible, please make your appointment. Those that will be newly eligible on Monday, look for that vaccine appointment tab on our website, click on that, and you will find the full range of options, including all of our healthcare system partners, our pharmacy partners, as well as the health department clinics. Again, if you are someone with lower exposure and do have minimal compromising conditions, do know that our ask is to gently see if you can wait for a bit before you sign up for a vaccine. We really want our highest risk people to have available appointments, but do know that everybody that does meet those qualifications is eligible as of Monday. Couple of data points related to vaccine for Eau Claire County. As of March 16th, we vaccinated over 5,000 people at the health department. So we do run health department clinics every week, all dependent on how much vaccine we can get. This past week, we've done over 2,000 in a week. So we have definitely capacity to do that and more on a regular basis. But with the vaccine we've been getting, we have been running single-day mass vaccination clinics at North High School and at other locations like in Augusta as well as Fall Creek. We are continuing to have those efforts move forward along with the FEMA site. Along with all of the vaccinators in Eau Claire County, 42,342 total doses have been given to Eau Claire County residents since the start of vaccination. So an increase of 62,000 doses since last week. So you can see we are putting a lot of shots in arms with all of the vaccinators that are working in Eau Claire. 26,000, more than 26,000 individuals have gotten at least one dose. That's 25% of our county population as a whole. And more than 16,000 have completed the series, about 16% of our total population. 56% of our 65 and older group has completed their series for COVID-19 vaccination. And as Dr. Rai said earlier, we are almost at 3/4 of our 65 and older population that has gotten at least one dose for COVID-19 vaccination, which is, again, amazingly positive news for one of our highest risk groups. The state announced today in their media briefing that the federal government estimates a volume of vaccine supply, so how much is being developed, that barring any serious interruptions over the next several months, we should have enough vaccine supply in the state by the end of June to have vaccinated everybody that we can at that 80% level by the end of June. So that's really hopeful news if we can get to that point. Again, a reminder that those individuals right now under the age of 16 are not able to get vaccinated with the current vaccine that we have. So the 3 types of vaccine that were talked about, the Johnson & Johnson, Moderna, and Pfizer, right now, we are not able to give to individuals under the age of 16. So with that, I'll remind you that our COVID-19 eauclair.org website is a really great resource for you on all things vaccination, as well as all kinds of other information about COVID-19. I'll respond to a couple of the questions that we got from media, and then if any questions came in via chat, and Audrey can help us with that, or if anybody that is on with us today from the media wants to ask a question, we'll do that at the very end. So the first question is, any focused effort the health department has made related to vaccinating the area population that is experiencing homelessness? So yes, we are actively working with our population that is experiencing homelessness. The providers in Eau Claire County, which there are a number of them that support the homeless population across Eau Claire County, have been part of our vulnerable populations team since the beginning of the COVID-19 pandemic, but they have been working closely with us, especially those that are in agencies that are supporting those experiencing homelessness and in those shelters. We are going on site to one of our largest shelters to provide vaccination, and we are working with all of the others to make sure that vaccine appointments are easy and accessible to those living in shelter. It's important work, and we take really seriously that that group is at risk, and we all as a community want to support them in getting vaccinated. So that, yes, they are being vaccinated this week and over the next several weeks as they have been eligible. So there's also a question about Eau Claire County. Have we got enough vaccine into arms here that we can partially attribute our plateau to, in new cases, to having more residents being vaccinated? Certainly, we are seeing that there are all kinds of factors going into lower case numbers. And we are hopeful that the fact that we have gotten a lot of vaccines in arms is making a piece of that difference. We know it's not the whole difference, since we still don't have a large percentage of our population yet that is fully vaccinated, but every step along the way makes an enormous difference. Question about what our advice is to local residents who are eligible in this next phase and are looking for get a vaccine appointment starting next week. Our advice hasn't changed. Please go to our website, covid19eauclair.org, click on the vaccine appointment tab. At that vaccine appointment link are all of the ways that you can get vaccinated. If you have a regular healthcare provider, particularly with those individuals that are newly eligible with specific healthcare conditions, we strongly encourage you to talk to your healthcare provider. It's a relationship that is important. We want you to continue that relationship. And if they are able to get you a vaccine appointment, we really see that as the best connection possible in this community. There are other locations as well, and those other locations are on our website. That does include our pharmacy partners, and that does include health department clinics as we have vaccine available. Next week, we were notified by the state that we have not a significant number of doses coming into the health department clinics, which is unfortunate, but all of those will be available as appointments on the website as well. Again, a strong reminder that anybody that is newly eligible, as you go online and make an appointment, please make one appointment and go to that appointment. Many of us as vaccinators are having people make appointments at multiple systems and then not canceling appointments when they decide that they go with one of those appointments. So please make one appointment and show up. It makes a big difference in our efficiency at the clinics that we have. Again, a reminder that likely 70% of our population is eligible for vaccine starting on Monday, so it will take some time to get through that list. We also have other ways for people to get vaccine appointments besides using the website. So again, if you are someone that is struggling with technology, please call our call center number. That's 715-831-7425, and we will help walk you through getting an appointment. Most of our providers also have a phone number connected to their location, so their phone numbers also can be used for getting appointments. The Aging and Disability Resource Center in Eau Claire County has also been an amazing resource in getting people connected to appointments that need that support. An additional question this week, the Assembly passed a bill that would allow dentists to administer vaccine as part of our COVID-19 response. How much of an impact will that have on rollout and reaching our herd immunity? Again, we want to get vaccine in arms as quickly as possible. It is not my understanding that we have any current dental groups in Eau Claire County that are pursuing that option, but certainly when and if that happens, we will be partnering with them like any other approved provider in Eau Claire County to make sure we get vaccine out to people that are eligible and that need to be vaccinated. Right now, we are working with the vaccinators that include healthcare, the health department, pharmacies, and UW Eau Claire Student Health Services and the College of Nursing. So with that, I will ask Audrey, are there any additional questions that have come through in the chat?
Yeah, there is a question about the FEMA site for you, Lisa. Can people sign up yet? Do you know how or when they will be able to? And do you know how long the FEMA site will be open in Eau Claire?
Good. Thanks for those questions. We will have a lot more information available about the FEMA site, hopefully next week. That is our goal. Right now, we are working through some of those logistics with our FEMA partners. At this point, we are not sure how large the startup will be. As soon as we know that, and as soon as we have the appointment process ready, we will be making broad announcements about that. We will be using the state sign-up system for our registration process. But again, as soon as we have those details, we'll make those available widely through our social media outlets, through our regular media outlets, and make sure that people across the region are aware of how to make appointments for that location. Currently, we are not we do not have a process for sign-up.
That was the only question that came in advance in the chat box. Is any of our media partners on and interested to ask a question live?
All right, with that pause, oh, go ahead. Yeah.
Sorry. I did have a question, and maybe this is for Lisa and for Dr. Rye. I have seen some confusion from readers about who are in phase 1C. They're eligible to start getting the vaccine on Monday, but they're kind of, wondering, can I make an appointment now, or do I have to wait to make an appointment on Monday? Could either of you address that?
Dr. Rye.
Mute button helps. Sorry about that, Sarah. I can answer on the behalf of Purveya. Yes, for Purveya, our schedules are open up for next week. We just ask that if you are in the 1C category or you're eligible, that you wait to get your appointment until Monday. In other words, don't schedule for this weekend. We still have restaurant workers, those who work in the courts, educators getting vaccinated through this time. So just make sure you choose your appointment, and you'll attest to that. But there are appointments open from Monday on forward until the following Tuesday, and then we'll continue to open up appointments as vaccine supply announcements come towards us. But we had our announcement last night on what we were getting, so we were able to open up those appointments for anybody who's interested. You do not need to be a Purveya patient, and information is actually on the Eau Claire County website on how to schedule with us, as well as purveya.com/vaccine.
And I will just name that that is a similar process with all of our healthcare partners, that their process to get in line is listed on our Eau Claire County website. You can, with all of them, make an appointment for appointments starting after Monday, which is the start for the newly eligible group. There are slightly different processes with each of our providers. Again, different attestation processes, processes to say, yes, I am currently eligible. And our ask is that those people sign up for appointments on Monday or after for those newly eligible groups. All right, with that, go ahead. Was there an additional question? All right, with that, again, thank you. We appreciate people's interest in learning more about COVID-19 and what's happening in Eau Claire County and across the state. We will be back next week, Thursday, to share with you an additional update like we always do. And again, thank you to Dr. Rai for joining us and giving that healthcare perspective. We hope people continue to find ways to keep one another safe, and we hope people find an opportunity to get a vaccine soon. Thank you.